Afternoon. Thank you. Very important session for us. I think we are all going through this. And I want to say this not just within the Global Fund architecture, but even in other spheres where we interact with our supporters, our financials, both at a country, regional, and global level. This thing shifts in priorities for financing in the health sector. I think we have experienced that in the last 2, 3 years. So I think this is about time we need to convene, come together and discuss this topic. So we are ready to start, I think. My name is John Beku. I'll be moderating the sessions. I'm working together with Lisa Marianne. We are both representing Yanaso here. Lisa is the coordinator for the Anglophone Learning Hub for Eastern Southern African and English-speaking Africa. She's the coordinator of the Learning Hub. I think most of you have interacted with her, providing advisory support to the Learning Hub. So we today this webinar has been planned. The main objective is at least to look at the what is happening in the context of uh, just hold on uh, financing of health programs within the region. We have seen a number of shifts in donor funding, and some of the most affected programs are within the HIV, TB, malaria, and of course the health systems in general. So this webinar has been set for us to come together, communities, together with our development and our partners, together with Global Fund, to just have a moment to discuss this, provide an opportunity for us to bring our heads together and discuss this topic. Give me a second to be able to get this to. Might need to be share again. Just hold on, colleagues. I need to get the slides working.
You are muted, John. If you are speaking, you are muted. Can't hear you.
Okay, sorry. Thank you. Thank you for that. Yeah, so as I was mentioning that I think we are in a very tricky and challenging situations for within the health sector. And this affects more the community interventions, community actors, NGOs, civil society organizations that have come together to implement health programs at regional and country level. We've seen these shifts in financing, reduced levels of financing from our development partners. Also, some of the priorities within the development partners have shifted. There's more focus on other issues. Globally, I think we've seen there's a very big shift in priorities. So that has reduced the available financing for health programs, and especially for those programs that support community interventions. Also within our countries, I think the needs have increased. There's a lot to be done. As much as we've made a lot of progress in addressing the three epidemics and other public health challenges, but you can agree with me, the needs keep on growing. So even the available resources are not enough. And also, we're in a situation where currently there's a lot of talk of integration. That means there's a lot of community-specific interventions that were traditionally implemented by community actors, moving to a platform where it's more integrated, and we will see the role of the community actors minimizing and reducing. So all these factors affect the level of what we can do as communities, as civil society organizations, the interventions that we can do, the financing for those interventions. And currently, I think all of us are going through the GC8 process. where we are designing our county program for the next 3 years, which is beautiful. And the narrative, I think all of you have heard this, that there's a lot of talk in terms of sustainability, transitional co-financing. How do we sustain the programs, the interventions that we have? And as we are designing the programs, we are being asked the activities that we propose, we should also think how those activities are going to be sustained beyond the external financing. What is the process for transitioning, gradual transitioning from external financing to domestic financing? And how do we structure the co-financing mechanism where we have governments complementing what we get from our external partners to ensure at least eventually our governments, at least they can finance some of these programs locally. So all this talk is happening as we are designing the grants. So we thought one of the things that we can do is to have this conversation where we bring people together to be able to discuss how this can happen and what will communities do, and what are some of the opportunities that exist within the GC8 planning that communities can be able to plug in and ensure the discussion around STC is very well covered and the community's voice is heard and they play a more leadership role in STC. Now, overall, I think we all agree, communities also agree that I think it is the mandate of our national governments to pick up the bills to ensure at least some of the programs can be domestically financed at country level. We all agree that is not a point of contention, but the challenge is how do we get there? And what is the role of communities in ensuring that these programs are actually domestically financed? What is the role of communities? That's the biggest question. And how can the communities engage and ensure at least some of the community priorities that contribute to the elimination or eradication or addressing the 3 epidemics and also building stronger health systems can be sustained? So that's the biggest question, and that's why we're here today in this webinar. Now, the structure of this interaction, we will unpack the STC concepts and guidance. We'll look at the emerging issues, and some of us who are already in window 1, window 2 have experience in the discussion around transition, sustainability, co-financing. I think we've gotten there, the window 1 and window 2. So we have experience, very lived experiences in those conversations. We'll explore practical approaches, what has worked where, and what has not worked, and also identify some of the non-negotiables. What is the bare minimum in terms of transition, sustainability, and co-financing? And this is from the perspective of communities. So that's the objective of this meeting. We, taking a step back, we understand that in the future, if we see some of the community interventions have disappeared, then we will actually know that when we are designing GC8, we did not think sustainability. So for example, if we are doing CLM planning right now, are we thinking sustainability? How are we sustaining those interventions that we are putting in our GC8? And what other mechanism will help us sustain all the community interventions that we have and ensure NGOs, community actors can continue providing support? So that's the overall objective. The specific objective are the 4 I've mentioned. The program for how we're going to achieve those objectives, we will have the opening remarks which I've provided, covering the objectives and maybe a few ground rules here and there. Then we will also hear from our colleagues that will provide more detail or just introductory to provide this theoretical understanding of what STC is, what it entails, and what does it mean, both from the country perspective and our regional perspective. That session will be led by one of my very long-term friends, Anthony Kingham. Glad, Anthony, to work with you again on this. I think we come a long way. So Anthony will be able to take us through that so that at least it can set the scene and ensure at least we can have a fruitful conversation. Then we will get into hear from Maureen on what communities can pay attention to when it comes to STC discussion. Maureen is very experienced in this, and she brings the perspective of communities at country level and communities at global level as a representative who sits within the communities delegation to the Global Fund board. So she brings that perspective and also try to anchor what Anthony will be giving us into more of a community language and the realistic, how does it really mean when it comes to communities. Then we'll open up the session for quick Q&A. Then after that, we'll get into specific country experiences. And I think within our region, we have Botswana that I think is actually in a transition phase now. I think even their grant they're getting is more of a transition grant. So we'll want to hear from the horse's mouth. How have they gone through this and what happened? How did they prepare for them to reach this level? Then we'll also get into a panel discussion. We will have a panelists that can give specific experiences within the GC8 process as we are going through them. We'll have 3 panelists that will hear from them. Then we'll open it up for question and answer again, for at least for us to be able to feedback, share more experiences, seek more clarity, and also maybe if we have any very specific and relevant experiences that have been missed out, we should be able to hear from the community that is here. Now, the most important part, again, we'll also get into the launch of a community guide to sustainability, transition, and co-financing. EANASO, with the support from the Global Fund, has managed to put together a community guide that provides step-by-step STC process for communities to engage. This guide helps communities to be able to participate and play a key role and what to watch out for during STC. And the consultant called Margaret Muinde who will be able to present that briefly. So at least we are aware of the tool and how we can access the tool and how we can use the tool to help communities to play a more leadership role, vocal role, active role in STC discussions. Colleagues, friends, I think we can agree that we have been very active in designing HIV, TB, malaria, community systems, health system programs in our countries. We have been very active, no doubt about that. But you can also agree with me that we have been inactive when it comes to, some of us, not all of us, inactive when it comes to transition, sustainability, and co-financing discussions at our country level. I think this is the time that we need to scale up that discussions, because once we get into transition is reality, as we'll hear from Nana. Once we get to that, we will be able to participate effectively. With that regard, I'd like to say thank you so much, and once again, welcome everybody on to this discussion. And I would like to ask and request my long-term friend Anthony Kinghorn to set the scene and deliver the presentation. Anthony, you had requested to project from your end. May I stop sharing, please, so that I can allow you to present?
I think it'll work. Okay, can colleagues see that?
Perfect. We can see it, so you can maybe put it on transition mode. Thank you, Anthony. Welcome.
Okay, thank you all. John, great to be working with you again, and great to see a number of other familiar names on the attendee list. Anyway, as you asked, is there an echo? Is it just on my side? Can you hear? Anyway, let me. Okay, good. So as I was asked, I'm going to be filling out a little bit more on what John said about the changing landscape and giving you particular perspectives from the Global Fund on the way that the landscape has changed and some of the changes that the Global Fund is bringing about in GC8 and beyond, to try and make sure that the response to HIV, TB, and malaria is sustained in the longer term. And as you're all aware, and as John has said, we've not only has the funding landscape changed, it's changed very fast. And on the negative side, we're seeing reductions in external funding, but we're also seeing countries getting more willing and recognizing the need to, for all of us to become more self-sustaining in terms of health financing. And in response, Global Funds made quite a lot of changes for GC8 both in terms of its approach to designing programs to make sure they're sustainable, and also to try and make sure that what resources we have are used efficiently and add up to effective transitions to sustainable programming. And so I think many of you from your countries would have seen the allocation letters. And in some countries like Nana's in Botswana and our colleagues in Namibia and Eswatini, there are specific timelines.
Anthony?
Yeah.
Sorry to disrupt, really sorry. I was wondering if you're able to do a presentation mode from your end, so that it's from your end, so that at least we only see the screen that is Yes, maybe you could stop the presentation and start it again.
Okay.
Thank you. Sorry.
Is that it? Is that
Yes.
solve the problem on your side? Okay. Sorry about that. Okay. So many of you will have seen that in this changing environment, allocation letters to countries have in some cases gone out and included specific timelines that countries are working towards to transition over GC8 and GC9. And also specific ideas for many countries on prioritization to try and make sure that that our responses are more sustainable, even in the countries that will transition later. So I think it's worth remembering that Global Fund has had a sustainability transition and co-financing policy for over 10 years. And as the request suggests, it is useful to just clarify what we mean. Sustainability is really what we want to see as the end result, where critical aspects of the program, of our programs and national responses that are stable and effective in the longer term, despite funding transitions. Then the transition is the process that we need to design and work on to make sure that we end up not only with short-term sustainability, but also longer-term sustainability and our ability to meet the needs of populations. And then co-financing, which has traditionally been seen as kind of a third leg of the policy, is really one of the tools that the Global Fund sees as a way of gradually transitioning to country financing in a sustainable way. And there are other tools as well. So some of the changes in emphasis that have come through with the revision of the policy for GCA8 is, first of all, the funding requests have to have a much clearer upfront sustainability narrative. And so I think that this represents not only a challenge to us in civil society, but also an opportunity to make sure that we are part of that discussion and articulate what it will really take to keep critical parts of our responses going. The Global Fund has also generally been much more proactive in saying what kind of co-financing we encourage countries to think about for GC8. We also encourage countries to focus on sustainability and transition planning and speak directly to that. And then we've got other changes, including in some countries matching funds for health financing and public financial management, which can be used to set up systems, for example, for social contracting, etc. There have been quite a few shifts from that board level policy change. I think one of the other important shifts that important for us to know about, as we say, how does civil society respond best in this, is that first of all, there's both a challenge and an opportunity that global funds could be much more focused on predictable transitions. So that's why some countries have been given specific timeframes for transitions. But importantly, all of the guidance and policy stresses that we need to be thinking about sustainability and transition, even in some of the countries that we know are longer term candidates for full transition. We need to be saying, how do we transition at least part of the response to make it make countries more independent of external support. Second big shift is towards prioritization. And this is going to be really important for civil society and your partners to signal in GC8 funding requests to show that you've looked at what we've done traditionally and said what is really important, what has the greatest impact, and prioritize that rather than what we've done before and the ways we've done it before. Then, as John said, integration is a big buzzword and one that needs to be very systematically included in your thinking. And so sometimes that means integrating some of the services traditionally funded, provided by civil society into perhaps more mainstream public services. But it also, I think, challenges us in civil society and academia to say, should we be thinking of ourselves differently in terms of sort of organizational structures and parallel systems, and how do we integrate those so that we can put in proposals that show that we're integrated and coordinated and efficient. Then a fourth thrust is specifically around community health systems and sustainable financing. So the policy and prioritization shift is very definitely conscious of the challenges to civil society and communities and how to sustain that. And so it does create opportunities as well as the pressures. And then the final thrust is around working with countries to mobilize funding and make sure that it's efficient, and then to make sure that a gradual transition of co-financing starts government funding of key activities well ahead of the time that Global Fund would and other partners will hopefully eventually leave. Okay, just to show, I won't go into detail on this, but it shows that in depending on whether your country is a low income or lower middle income country or upper middle income country, there are specific transition and sustainability approaches that Global Fund suggests. And so being familiar with those will be important to saying how does civil society work best in this context to manage these pressures. And I think one of the things that's worth noting is that Global Fund has developed frameworks and approaches, but we also have to be aware that other key partners are also reducing their commitments to countries, and so it might be that we have to. It may be that we need to also be thinking about transition and sustainability more broadly. Also, I think one of the other perspectives that's important to bear in mind is that traditionally Global Fund has foreseen a focus on, first of all, sustainability, and then gradually building in a transition and then using tools like co-financing. The reality at the moment is that transition is often going to be the focus in some countries, and it's going to be really important not to lose the learning that we had about what longer term sustainability requires in terms of planning and understanding in the short run. And also we need to recognize that even where the transitions aren't necessarily happening fast on the Global Fund side, similar logic is going to be important to use in relation to US government and other transitions. Okay, this slide I won't go into detail, but perhaps just to focus on the main messages in red. What you can expect is going to be the lens that the technical review panel and other Global Fund partners will be looking at is, has civil society and the national response actually realized that we can't just keep on doing the same things in the same way. We need to rethink our approach to various things and look at efficiencies, look at the critical impact determinants and sustainability. So it's going to be important to say, have we looked at innovative ways of doing things and different ways of working as part of our thinking, and where you can demonstrate that, it'll definitely strengthen your position in many cases. And then the second headline is for you and the country, the broader country funding requests to show a very clear approach to prioritization of particular functions and sub-functions, even within what we've traditionally done, and make sure that we're focused strategically on those priorities. will strengthen both civil society and the funding requests overall. Okay, and so just on that point, that I think that it is important, and I think it gives civil society some leverage, not only a challenge. The TRP is going to be looking at those funding requests with a new focus on sustainability and transition, not only in the transitioning countries, but also the other countries that are further away from global fund transition. And they're going to be looking for funding requests that are really clear in identifying the most critical sustainability and transition challenges within the very broad range of interventions and services and functions that each of the parts of the response have contributed, and saying, has this funding request actually responded to them? So I think where civil society can make sure that it can indicate where critical contributions of civil society have been neglected, which might undermine the impact and sustainability, that, as I said, gives you some leverage, not only just a challenge in keeping your own components going. And the other challenge which will be important is to recognize that the guidance on the funding requests has a strong emphasis on the funding requests interfacing with national planning on transition. So in countries where you have things like sustainability and transition roadmaps underway, it's going to be really important for civil society to influence those and make sure that the key contributions of civil society are reflected in the national plans, as well as in some of the pre-existing plans like NSPs. So the TRP is going to be looking at things with probably a much more critical eye, again, trying to make sure that we are not just doing business as usual, but really responding to sustainability and transition needs. Okay, this final slide just reminds us that there are quite a few bits of both older and new guidance available from the Global Fund. As I said, sometimes we can forget about the sustainability thinking because we're so focused on shorter term transitions, and it can remind us as sustainability investment guidance and value for money investment guidance are worth referring back to as we try and prioritize and make decisions and work towards sustainability. Then there's guidance on transition and domestic financing, and then on transition timelines, which are really important to bear in mind, saying what we need to do at the beginning of GC8, middle of GC8, and then going into GC9 from a strategic perspective, and articulate that convincingly so that civil society remains strong. Okay, thank you very much. I hope that gives you some idea of the way that Global Fund has been thinking and the kind of ballpark as from the Global Fund perspective, and also hopefully prompt some questions and critical thinking that can help us to decide what the next steps are for civil society. Thank you very much.
Many thanks, Anthony. Thank you so much for that. That is really helpful in understanding from the Global Fund perspective, and also what communities or partners need to do as people are preparing their GC8 grants. And I think also, Anthony, you provided more than that, more than just within the Global Fund architecture. But I think some of the issues that you've presented, they are very applicable beyond the Global Fund. It's how communities, how partners can engage in ensuring that not just thinking short term, as you mentioned, but looking at more longer term sustainability of interventions, as opposed to just transitioning. What does it mean in a longer term? Can these issues be accommodated within the national budgets? Can they be accommodated within the domestic resources long term? So that I think is very, very critical. Timelines, again, you've also reminded us, very critical to look at that. It's a process that is gradual, and I think that should be inform our planning and our engagement at country level on how can communities engage in a process that is more gradual and takes time. As much as we also talk about it's a gradual process, that I also don't think timelines are adequate. Even if you're given 101 years, I don't think people will be ever ready for transition and fully financing of health programs within their countries. So even that timeline is there, but I think that we also understand that we need to be able to see how within this short timeline, how can communities engage and ensure there's the sustainability of community interventions. Thank you so much, Anthony, for that. That is really cool. I hope, Anthony, you are staying with us, or if so, in case there's any question or a comment, I hope you have been us with it. Yeah. Yes, thanks. Thank you. And now, colleagues, I think unfortunately, Maureen is not able to make it to. Yes, please, Anthony, your hand is up.
Sorry, I just got lost between screens, but I can stay around for a while.
Okay, that's fine. So I think
the discussion. Yeah.
Yes. Yeah. So what we're going to do is we're trying to just do a very quick recap. Then we can ask colleagues for who can step in for if there's any question, any comment, or anything they need to add from that presentation. But just to remind us, we've seen that why do we need to do this? Why do we need to talk about transition as Anton has presented? One, I think we've seen we might lose this danger of losing, or the risk of losing community-led responses as we've crafted. And I know we work with diverse communities, and we cannot be guaranteed to have all these community responses, best strategies that are working now, guaranteed when we transition to domestic financing. The other thing I think also that we have some populations that might suffer a great deal. That is the key and vulnerable populations. I think there's responses and services that target key populations and vulnerable populations. We might lose them out or even dilute and not implement them the best way we need to implement them. The human rights interventions as well might also be affected. I think that one we've seen. And also our advocacy interventions that are financed, most of them are financed externally. I think there's a risk of losing those ones. And I think the very good example is the community-led monitoring as a strategic approach and as a community intervention. How do you see the future of this intervention when we transition? The big question is, how do we play a key role as communities to ensure that all these that we've mentioned are not lost or diluted in terms of the implementation? And how do we fit in the larger discussion around integration, so at least to be able to ensure that even when we're doing integration, we have the best community interventions that still play a key role in addressing the 3 epidemics. So I just wanted to provide that and also take advantage of the few minutes that we had for Maureen that could not join us. And friends, I'd like to open it up now for any comments, any question that you have, any point for clarification, or if you want to add anything, please just raise your hand and we'll hear from you. Yes, Onesmus Mlewa?
Yes, John, maybe to add something.
Oh, yes, please. Philip, thank you so much, Philip. Yes.
This is Philip Nyakwana from Kenya. Thank you very much, John and Anthony, for the insightful engagement. I think I want to say 2 or 3 comments that's almost related to what John has just reiterated on. And I will begin by asking a question. I hope you are hearing me. And my question is, we are having conversation around transition and that kind of. My question is, where are the communities in this conversation? Because if we cannot talk of communities there, and they are not involved in terms of planning, identifying priorities, and also being part of people who are monitoring the transition process. So where are the communities in this thing? So to me, I would also like to say that first, we need to identify what is it that we are transitioning. We should have a phased approach where we are able to identify what is it that we need to transition by when, and what resources do we need? What is it that we need to help us in terms of transitioning from where we are to that place? When you look at some of our conversations, including around transition, we do not have budgets and resources allocated toward conversations around transition. So who funds the transition agenda? Who supports this conversation? So we are talking about transition and at the same time looking up for donors to support our transition agenda. I think that is wrong. We should be able to allocate, mobilize resources locally to help us do our transition. And this must be anchored within a plan. So I think first thing, each country, if you have not yet there, to develop a clear plan of what should be done by when and the resources that are needed for us to do that. All in all, the community must be at the center of this. Thank you, John.
Thank you, Philip, for that addition. And I think those are very critical things that we need to think about. Here we are with this platform as communities engaging, but the big question is the transition is expensive. How are we financing it? What are we transitioning? And we need to have a clear plan. Thank you so much, Philip, for that reminder. Yes, Onesmus?
Thank you very much, John, and thank you very much, Anthony, for that succinct presentation. I just have one concern. When you were presenting, there was one of the slides that was talking about countries that are moving towards accelerated transition in GC8, and those ones that are targeted or planned for transition in GC9. So probably, if I may ask, what's the Global Fund plan when that time comes and countries still are not ready to transit? Because what's happening is the threshold of transitioning, as you have explained, countries that should have their health systems quite in order, some measure of increased domestic financing to ensure that they are ready to transit effectively. So what's the plan of the global? Will this time come and countries are still not yet ready to transit because they have not met the threshold strategy? Thank you.
Thank you, Onesmus.
When you come today, leave the country away.
Yes, Anthony, are you in a position to quickly maybe give some insights on those?
Maybe if I can just speak to both Onesmus's comment and the follow-up.
Thank you.
One of the key issues is to make sure that civil society is well represented in CTM processes, both so that you get the information as a broader civil society about the transition timelines and functions, so that you can work together, for example, to identify what are the critical contributions and comparative advantages of civil society, and then build your plans for GC8 around realistic time frames and a good logic of what you need to do and how you're going to do it. Just on the issue of financing transitions, I agree it's highly desirable if you can use domestic resources to sustain yourself through the transitions. But as I mentioned, I think one of the critical things about GC8 is, first of all, some countries have matching funds that can be used to develop processes around civil society and social contracting, for example, and potentially capacity building of civil society organizations to be able to function under social contracting. And importantly, for the countries that are close to transition, it's really important to know that final grant is not so much about funding the same stuff as we funded before. It's more about gradually transitioning that and then using other funding to help civil society and other key players transition. So the funding needs to be catalytic rather than maintenance. And so that creates opportunities as well as challenging situations in terms of keeping the core services going that you'll need to balance. I think in terms of the countries that are facing accelerated transitions, the Global Fund has been transitioning countries for quite a long time in other regions. And I think one of the key things to internalize for those of us who haven't had to face transition so recently is that we really do have to see that the end of the transition grants as a full stop and work accordingly. We can't rely on the possibility that there might be extra funding. And so it's really important to plan as though the countries will have to transition. As I said, we can't assume that there's going to be extra funding. I think in some of our countries where, for example, PEPFAR or Global Fund have in previous years, say, cut funding to community health workers on particular areas, then the other partner has tended to take over. The situation is different now, where it's going to have to be the country that takes it over. And unfortunately, I think we have to recognize that the country is going to be prioritizing hard, even if hopefully well, in deciding which activities keep going strongly and are maintained and which not. So unfortunately, I think we do have to see it as a hard stop and make hard prioritization decisions and help the countries to make good decisions as though it is a hard stop. Thank you.
Thank you. Thank you, Anthony. For that clarity, any other comment, colleagues? Yes, Anwana, your hand is up. Is it Anwana? Just unmute your mic if your hand is up, please.
I have unmuted them. They can speak.
Yes. So
Yes, please.
I want to say I'm glad to join, even though I was struggling with network. From all I gather for the little time I've joined, I've discovered that transition must really be planned. It must be gradual and resourced, not abrupt transition. We are not just talking about drugs or commodities or whatever. There must be co-financing that will count. I also want to say that communities would want to transit, but only if equity, rights, and maybe community systems are protected, funded, and co-led. That will actually lead us to a tangible transition system that we are looking at. Thank you very much.
Thank you for that addition. And I think it makes sense that it must be planned. It's not just abrupt. It must be planned, gradual, and it is not just within communities and a few things here, but the nature and approach that we use for transitioning must reflect the country needs and the gaps that were there, and also the readiness within those areas of transition. So thank you so much for that comment. Lisa, do you have any other person with a hand up?
We do have a comment in the chat box from Richard. Richard says that how is the Global Fund ensuring the meaningful involvement of community-based organizations in the planning, implementation, monitoring, and evaluation of Global Fund supported programs? Then he goes ahead to say what opportunities are available for CBOs to participate in Global Fund processes, including funding, decision-making, and community-led monitoring. How does the Global Fund engage and support grassroots CBOs to strengthen community health systems and improve service delivery? And last but not least, he asks, what criteria and mechanisms does the Global Fund use to identify, fund, and build the capacity of local community-based organizations, particularly those serving in underserved regions?
Thank you, thank you. Those are many questions. Let's pick another one from Dr. Dax in Namibia, I think.
Hi, good afternoon, colleagues. Dr. Matwikwani Dax from Namibia. I think my contribution would just be for us to also bear in mind that this transition, the talk of transition with the Global Fund is not a new concept or a new topic, and that it has been coming for a while, for years, right? And we also should be aware that there are different categories of transition. So this is an ongoing conversation. And then maybe also, as we are discussing here collectively from our different backgrounds, maybe also to just take into consideration what work has been done towards transition from our different countries and what work still needs to be done, as was already alluded to. So this is not sudden, right? The dramatic withdrawal of the US from funding has shaken a lot of us, but it should also just maybe be a call to action for us to plan realistically and plan in a manner whereby we can hold ourselves as members from our different countries, our CBOs, accountable when we are doing these plans. Because maybe in prior years when we were planning, we were just writing because we needed to write, not knowing that the day for withdrawal of these global health organizations would actually be a reality. So I think that would just be my contribution. Namibia is also still a transition country, and even as we are still working towards it, and it's necessary for us to just be considerate of that fact. Thank you.
Thank you, Dax. Anthony, there was a question on how the Global Fund supports the transition process, especially with the perspective of supporting communities. Is there any insight there?
Yeah, well, as you said, Richard, you asked a lot of very important questions, and I'm not sure I can do justice to all of them. But Global Fund has systematically tried to make sure that community perspectives are systematically built into our mechanisms. And so one way is to make sure, as far as possible, that you are familiar with the requirements around the CCM and the funding request processes, for example, and make sure that civil society and communities are adequately represented there, because they are structured in a way that is supposed to service that. There are also other aspects like co-financing. So in the countries that have higher national incomes and GDP that are closer to transitions, the co-financing guidance is very explicit that the co-financing by government must focus on bottlenecks to transition, and particularly around bottlenecks for key and vulnerable populations and the services that reach them. So that, I think, is a really important guidance that civil society and communities can work with. And I think there are challenges around underserved populations as our resources shrink. It's often the most difficult to reach populations that tend to get the shorter end of the stick and find it more difficult to access services. And there, I think, again, the Global Fund really emphasizes the importance of reaching the people in greatest need and the people who are going to be most critical to maintaining control of epidemics. And they're often not the easy to reach people. So hopefully the epidemiology and other factors will also support communities. But as I said, I'm not sure I've been able to fully expand on it, but just to I think point you to some of the ways that the Global Fund has tried to make sure that the systems are set up to give space to civil society and community. And then Nwanta, you raised important questions. I think one of the perspectives that you raised about the need for gradual transition is very important. And so although the transitions are in countries like Botswana and Namibia and Eswatini perhaps unexpected in terms of the deadlines being set, we have, as Dr. Dax also said, always known that at some stage that transition needs to happen. And even in countries like Botswana and Namibia, it should be at least 4.5 years of global fund support to organize a transition and make sure it happens effectively. So I think that hopefully within the global fund grants, there will be space, but as was also mentioned, it's really important to plan that as intentionally as possible. So the current grants should be very clear in saying what's global fund going to be funding in year 1, 2, and 3, and how much of that year 1 funding is going to be taken over in year 2 and 3, and then finally in year 4 to make sure the transitions happen in the key places. And yeah, so hopefully that will means that the transitions are pressurizing, but hopefully not impossible to cope with.
Thank you, Anthony. There's a very interesting question on the chat box that somebody's asking that who determines a country's transition?
Sorry, who determines?
Who determines that a country? Which country should transition and what time?
Yeah, well, broadly, as you would have seen from that one slide busy slide that I skated over, a huge determinant, well, there are two main determinants. One is the burden of disease. So in countries where there's a higher burden of disease, the Global Fund has tried to maintain support for longer. And then the other is country income and the country's own capacity to take over, both financially and in terms of other capacities that might need to be strengthened. And so the Global Fund systematically goes through and says, what are the economic trends? What are the epidemic trends? How resilient is it and equipped is that country to take on more independence in responding to the epidemic? And so we all know that within all of our countries, there are always vulnerable populations who don't fit with the per capita GDP or other fairly crude measures. But Global Fund does try to make sure that it's reasonable and equitable in those decisions.
Thank you. So it's determined by those variables that we look at the disease, the need, and the progress towards addressing the 3 epidemic, capacity to pay, the burden, and all that. So, but there's another also very interesting question that is being asked that, and I think this is very important for all of us who are here. Anthony, is there a possibility of having everything else transitioned in a country except community interventions? Only community interventions that are implemented by the networks, by the key populations, those ones cannot be transitioned, and they keep on being funded through the Global Fund mechanism. But the rest of everything else is transitioned. Is there a scenario like that?
There isn't an explicit scenario like that. And I think, I think that the best situation is where countries really do become independent of external support. I think that the reality is going to be challenging, and I think maybe one of the first things we should do is say, are there internal mechanisms that will help us stabilize some of the key parts of civil society contributions? And I think, for example, alliances between academia and civil society, whereas traditionally they might have worked separately, there may be ways for them to create some institutional stability as well as keep some of the critical programming and agendas going in ways that maybe we haven't explored that we should, because ultimately they're going to be more sustainable and reliable than external funding. So I think I'm afraid I can't tell you that there is a definite scenario of ongoing support after the transition for civil society. but I think that there are some ways, even internally and in our challenging country contexts, where we may be able to develop plan Bs that will help for the help critical contributions to keep going.
Thank you. I mean, at least there is a way where some community-specific interventions can continue being supported as other components are being transitioned. And so it's all about planning. It's all about community engaging and prioritizing the transition issues to be transitioned together with the public sector, working together and drawing up a very good plan that can identify the things that can be transitioned and things that may not be transitioned progressively. So at least I think it's all about having communities at the planning level and during the implementation. So when they do the analysis, the risk of losing some interventions can be identified at that place, and priorities can be given to some things that can be easily transitioned and some things that are. If you look at the challenging environments, especially for KP programming, then the KP community sitting at that table should be able to participate at that level and identify what they feel like the country is not ready to actually transition on some of those components. Yes, yeah. Thank you. Yes. Any other comment, guys? Any other question for Anthony before we move to the next session?
Let me just quickly ask a question. So one of the KP co-moderators that we were supposed to have today, unfortunately, they were not able to join because they're in a costing program. However, they asked me to ask on behalf of KP communities. KPs still continue to experience significant barriers, especially in the Anglophone and even basically just the region in general, the African region, due to structural, systemic, but also cultural barriers that amplify stigma. We hear of criminalization in most African countries, police brutality, manhandling, and a lot of violence against KPs. So even as African countries are beginning to think about transition, how can we ensure that KPs are still protected and their programs are resourced even as Global Fund thinks of transitioning? Because, transition, sustainability, and the whole conversation around integration is not a one-shoe-fits-all type of affair, right? So in their context specifically, how do we ensure that we reduce human rights barriers, challenges that may retrogress the gains that have been made in terms of protecting KPs and ensuring that they get adequate, timely, and comprehensive services? And when I say comprehensive, they meant services where they can access HIV prevention, care and treatment, mental health services, GBV support, legal support, and even TB support as well.
Could I, I'll attempt again, Lisa, thanks, and thanks for your colleagues who sent that query in. And I think it is something that is of concern to all of us as we look at transitions. And I don't think that there's a simple answer to it. I think that the one thing is trying to maintain funding, and I think that there maybe some of civil society might find new ways of securing funding, for example, through international foundations, for example, that can support them, even if Global Fund has declining resources. So diversifying might be an option for some. I think one of the other things is, that quite a few civil society organizations have had to do, even under the current circumstances, is change the approach that they've used in repressive situations to support members. And quite often that, for example, might involve having advocacy perhaps more broad than for specific key populations, which supports various people to overcome various other stigma and gender and other rights-related barriers, both to just being personally safe and not at risk of common assault, as well as having safer spaces for women who are suffering domestic violence, or children who have vulnerabilities, as well as other key populations. And there may be ways in which civil society can strategically keep things going in slightly different ways that will hopefully protect members from some of the scarier prospects of as external funding withdraws. But I think that you're going back to what John said that earlier. I think one of the key things is for civil society to kind of look at all the important things that are being done at the moment, and say what are the key things that we do and what that we use to support people, and then are there different ways of doing them and packaging them and getting them funded that will add up to resilience. And I think that it's going to be a much more robust approach that you can propose to Global Fund if that comes from community organizations looking at answers themselves, rather than just hoping that, feeling that there's no hope without the money just keeping on flowing in the way that it has in the past. So I think it's a challenge to all of us to think a bit differently and creatively. And I think it has, one of the comforting things is that one of civil society's greatest assets has always been its adaptability and the way that it can do things which governments and other people can't in an responsive and imaginative way. And so, although it's uncomfortable for us, hopefully we'll be able to succeed in that.
Thank you, Anthony, for that. We can take maybe one last one, then we move on to the next speaker. Sylvia Ayon, please. You have a question, your hand is up. Lisa, are you able to unmute Sylvia Ayon?
Okay.
Yes, they're unmuted.
Oh, that's great. So thank you for the opportunity to be in this timely call. I'm Sylvia Ayon, Executive Director of a community-based organization in Makadara, works with young people and also underrepresented communities. So I'm saying that in this transition, I think continuing to meaningfully engage community is central to the sustainability. Having said that, is the community representation that I see currently is also experiencing a lot of competition within the community itself in terms of representation, and also looking inwardly. We are the community, but we also, in these positions, we have a lot of trying to protect the turf or ensuring that a certain group of people are elected into these positions. So asking now, because the community are really central to this sustainability, what mechanisms within the Global Fund are there to really safeguard the idea we had around community engaging in decision making, so that the community participation goes beyond just implementing the different grants that we have, to being more of actually being in the decision making, and one that truly reflects the diverse community voices, and particularly of grassroots and the underrepresented communities, despite the shrinking fiscal space. But these are issues that we need to really look into, because I think they are watering down the gains we are making as a community. But in order for the community to move forward, these issues need to be addressed. Thank you so much.
Thank you, Sylvia. Anthony, what are these mechanisms that are there to safeguard community voice and scale it up to decision making, not just implementing programs?
Yeah. Okay. So, Sylvia, in terms of the broad mechanisms, I mentioned earlier that trying to ensure that the spaces created by the CCM mechanism are as effective as possible is really important, and taking advantage of specific funding that might come through the co-financing requirements and the focus of co-financing in some countries. Also, some of the other system strengthening components of programs, which can be used to strengthen community-led monitoring and advocacy and other key functions will be really important. So I think that the Global Fund does try to make a space for civil society to do that, and I think so. Hopefully, organizations like yours and similar ones will find space that they can grow good ideas and successful proposals in. It is a challenge, I think, as you mentioned, this competition within the sector as well, and I wouldn't be able to advise on how to do that. I think in the past we've used umbrella organizations to try and deal with that, and that created its own challenges. So I would hesitate to say that that anyone has a particular answer that fits all places. But hopefully, with community voices having space and the creativity to solve these problems, there will be within the Global Fund system. You will be able to succeed.
Thank you. Many thanks, Anthony. This is really helpful and very informative. And the most important part of this is that there is an opportunity and there are mechanisms for communities to engage in STC, transition co-financing and sustainability, and especially hearing it from the Global Fund itself. So there's when transition is happening, we understand that communities are in a position and should be able to play a key role and engage effectively. So thank you so much, Anthony. And it is always very good working with you, fun working with you. Yeah, thank you so much, Anthony. Yeah,
thanks, John. Thank you, colleagues, for your interesting and insightful questions.
Thank you. So we have more questions that actually we will pick them up, put them, compile a list of questions, and maybe should be able to find some answers to those questions or insights or direction on where we can get answers, and then we should be able to share with some of us who are here, all of us who are here. So thank you so much. Now, as we want us now to hear from a country that has actually gone through and is actually going through transition. Can you believe that? In one of our countries in this region that has actually gone through transition and they're actually working towards through that. This is Botswana, and we have our friend, colleague, Nana, who's online today, to be able to give us a perspective and their experiences and what they did. What are some of the success factors in their transitions, and also maybe what to watch out for, the don'ts in transition. So at least for us, some of us who are not there, we should be able to prepare very well and learn from people who have gone through it. So in this, with that regard, please allow me to bring on board Nana. Nana, please, if you are on, you can unmute and then can you hear me, Nana? Nana Gilson? Yes, please. Lisa, are you able to unmute Nana Gilson?
Yes, I have unmuted her.
Yes, Nana.
Oh, okay. No, I just
panelists.
realized. Thank you. I just realized that I didn't have the option to unmute, but you've allowed me now. Thank you so much.
Thank you, Nana. Welcome on board. Colleagues, Nana is from Botswana, civil society, Bonella. I think most of us who are here know her. A very active community advocate in protecting community interventions within the Global Fund and ensuring that these community interventions are staying beyond the Global Fund financing in Botswana. Welcome, Nana.
Thank you so much. Thank you, John. Thank you, Anthony, and thank you everyone who's on the call. I must qualify the statement. We haven't fully transitioned yet, but we are in the transition process. So our GCA grant will be our transition grant. But obviously, like Anthony said, transitioning doesn't just happen overnight. It's a process, and I think that's a good segue for me to start my presentation, just to give some context to our process and when it started, and the different elements, different activities that have occurred, and basically just to create some awareness amongst other members of the communities in different countries in terms of what to prepare for transition and the steps that are required, especially from a community perspective. So basically, this diagram, it shows our Botswana HIV sustainability roadmap development process. And the reason why it's relevant is because I think, if you will recall, UNAIDS was supporting countries to develop these roadmaps. But at the same time, also, I think PEPFAR initially was doing processes in countries really to look at readiness around transitioning, because there were a few countries on the radar in terms of transitioning. And then also Global Fund for us as Botswana had already been hinting, I think as far back as 2022, that, the way your disease burden is going and your resource availability at the time. And I want to again put it in brackets because some things have changed since, but just so that I give you proper context about how this was developed, it's important to say that at the time, those are the factors that basically motivated this process. And so Botswana basically developed a sustainability transition readiness assessment and a sustainability roadmap for Botswana. And it was a collaboration between the Global Fund, PEPFAR, Ministry of Health, and UNAIDS supported it with TA, and then obviously civil society and private sector as well. And so the whole process was to use a foundational assessment based on about, I think it was 4 domains, to really assess Botswana's sustainability and transitioning. We looked at sustainable financing, we looked at health system strengthening, we looked at governance, coordination, human rights and legal environment, we looked at the CSO environment. And some of the subsets around these was really looking at fiscal space, the GOB budget at the time, any kind of efficiency measures that could be put into play. We looked at procurement and supply chain, M&E, laboratories, HRH and training, and the integrated service delivery approach. I know with GC8, that's a big area. It's really emphasizing that countries look at integration. But again, even integration, it's a process, right? You have to look at how your systems can cope with the integration. We also looked at governance and coordination and really how the programs would be rolled out to be as efficient and enabling as possible. We particularly looked at human rights and the legal environment. One of the processes that we had done prior to this was to do a human rights plan for the country, a 5-year plan, which is something that actually will be ending in a couple of years, and we actually need to look at doing another one so that can also be rolled out at the same time. Because obviously you need an enabling environment, like colleagues have talked about. When you're programming with vulnerable populations, with key populations, you need to make sure that the environment is an enabling one. So we looked at that. And then we looked at CSO engagement. And this is where, civil society needs to understand, how are they financed? Is social contracting being applied? What is the capacity on the ground? Does there need to be specific capacity strengthening that's applied? So we looked at all of these and looked at them in an analytical framework, and basically contributed to the different technical working groups that was working on each of these areas together with the consultants. They basically did a data collection process. We also did stakeholder engagements. And I just want to say that with the data collection, it wasn't just about the data around the areas we're talking about. They also did sort of desk reviews. They looked at HIV allocative efficiency. They looked at the national aid spending. They looked at fiscal landscape. So all the things that sometimes you do towards grant proposals for global funds and any other donor, it was a good addition to the process that was underway, and basically developed a graph that showed where the money comes from for the response. And we were able to really appreciate the different contributing entities, and that also helped us understand that, okay, in the event that any of these leaves, what does that mean for our capacity to sustain the gains around the program? There was also extensive stakeholder engagement. I know, when you have to constantly have meetings, people get tired, but I cannot underemphasize how important it is to engage and fully understand and create ownership around such processes. Particularly because with the Botswana one, we actually managed to get the vice president at the time on board and ministers on board, because obviously, people are in positions of power and they're the ones who ultimately make the decisions around some of these areas. So it was really, really important. There were extensive consultations, there was key informant interviews across districts, there was specific line items in our joint oversight committees, in the national aids pre-briefing, so that it was a constant point of discussion. I mean, it still is a constant point of discussion because we haven't fully transitioned yet. Oh, sorry. Should I continue?
Yes, Nana, we can hear you. Continue.
Yes.
Colleagues, kindly mute your mics. If you're not speaking, please mute your mic. Thank you, Nana. Sorry about that.
Yeah, no problem. And then, basically there was also an analysis done around the key areas of financing, because you may have resources, but maybe the funds are not going to the right places, right? I think globally, one of the biggest challenges that have been for countries is, money for prevention. The global standard is 25% for prevention, but when you analyze how much money is going to that, you can see that not enough is going to prevention. For example, at the time when we did our analysis, we realized that only I think it was 12.5% was going to prevention, unless it was from outside donors. So that was the particular area we needed to be mindful of, because it means when you're transitioning, there has to be a greater allocation from domestic resources for that kind of programming. And one of the specific areas was obviously key population programming, and how would we fund that? And I think this is where, for example, the social contracting process, I need to talk to that a little bit. Global Fund had supported us also to do almost like a pilot. And Anthony, please don't kill me for using the word pilot, because I know that nobody wants the word pilot. But we basically used one of our grants to roll it out to see whether it was something that could work, and to also support the government colleagues to go and see social contracting in action in other countries, and come back and see how to apply it, and then also sort of engage to try to help us to develop our own social contracting. And that's how we got, and also some support from UNAIDS in the region. We then were able to roll out our social contracting, where government funds our human rights program, funds our KP program. Obviously, maybe not enough, but at least it was a start. And this has been ongoing. And so we are able to see that, there's an allocation each year from the fiscus, from the budget, towards this programming. And I think some colleagues talked about it to say, how do we ensure that, key population programs don't just disappear when countries transition? It's a journey. You have to start by introducing a way in which government systematically, conscientiously, consistently funds these programs through domestic resources, even while you have the donor support, so that you can see that, does the program work? Will it be rolled out with fidelity like the other programs are? Obviously, most governments don't have the same amount of money, so you need to also look at how you can optimize the offering to be able to still continue to give, to provide programs. And so those are some of the things that we looked at, and those are some of the ways in which we've managed to roll out the programs. So that I go quickly, I know I don't have so much time. We also did a risk analysis. So, best laid plans and all, nothing always goes ahead as the way you want it. So we needed to analyze to say, what are the risks of things not working? What are the risks of funding ending early, for example? I mean, our current reality is similar to that. Maybe we had a premonition, because some of our programs were being funded through PEPFAR, and with abrupt end of the or reduction, let me not say end, because obviously there's a new plan in place, but with the abrupt cutting of funding, it meant you needed to pivot, like immediately, to say, how do we continue to provide services? Some of the staff were no longer there who were doing certain roles, and those were some of the risks that we had already identified when we were doing our assessment, and had already been saying, how do we do an HRH program that we transfer skills? Obviously, we hadn't even, we were maybe in year 1 or 2 of that process, and things happened, fast-tracked our process of actually needing to transition some of our programs and look at how we provide services in a different way. But basically, we did an assessment, and I think we identified about 21 risks across those 4 domains. And we basically gave them colors to say, is it amber? Is it red? Is it yellow? Is it green? So that we could see that what needs to be addressed when, and how urgently, and what level of resourcing is required for each of these interventions that need to be addressed by the time that we are fully transitioning. So all of that was work in progress, and we were, we in the diagram, it just shows the main areas where we, identified risk. It was around financing. It was around some health systems risks. It was also around CSO engagement. I don't know if the problem is the same across the region, but in Botswana, we were having fragmentation of donors, fragmentation of CSOs. Like it creates inefficiency. So you need to see, how do we make sure that we're getting the bang for our buck across whichever CSOs are providing services, and feeling like we trust the system enough for everybody to be transparent about what they're doing, and the resourcing that they're receiving, so that we can still see that, how do we make sure that we can do whatever we can do with the resources that we have, and that we're not being duplicative in how we're providing. Obviously, it's still something we're learning, because we were thrust into it faster than we had hoped, but it is work that we're doing. And then really looking around human rights, governance, coordination. Yes, again, we have a program where government funds key populations. We have the human rights plan. We have, quite a lot has been done in those areas, but it doesn't always translate into operational programs. We still have to, as civil society, do advocacy, engage. We have backlash, the same kind of challenges that people are having. We do have them, obviously, at different degrees, but it still needs support. It still needs resources, and you don't always get the amount that you require. So you need to, again, look at, how do we make sure that whatever resources we get, we can still use that to make some difference. And with the Global Fund grant, we were one of the countries who was lucky to have the Breaking Down Barriers support, that basically meant we got matching funds. So again, civil society was in a position to do advocacy with government to say, here's a donor who will match the funds that you're going to put into a program. So that was, I think, a good strategy. And if Global Fund can continue to do that, I suggest that they do that and roll that out across as many countries as possible, because governments always know when they're getting a good deal. Nobody's going to leave money on the ground. So if somebody's saying to you, I will give you whatever it is that you put in, that's getting resources, and that's a good way to leverage additional resources, and also to make sure that, again, those funds are consistently brought into national budgets, and you get to show governments why these programs are important and how they help to increase impact around the different programs, right? And then just basically, at the end of it all, we developed our transition plan, and we gave assignments to different groups. They are coordinated by the Joint Oversight Committee. Obviously, I must say that for Botswana, uniquely, what happened is that we got a new government. So after all the work and the effort and everything that was done, we, by the time the plan was done, we were now transitioning again into a new government. So it meant that all the different conversations with the different departments and everything, we needed to start that again. And we needed to sort of remotivate why certain things were important, why we need resources, and some of it was being done, but again we had another challenge because of the global recession with everything that was happening. It meant that one of the ways that Botswana had been able to fund its response diligently and to the level that it had was that we had diamonds and we had beef, and now nobody's really buying diamonds the way they were. They're going to war. And I hope I'm not offending anyone, but that's the reality. And it meant that obviously our fiscus has shrunk, and our capacity to support the program the same way has changed. And so while we had all these best laid plans out, ready to roll out, some of the things we have not actually been able to do. And we are still a pre-transition country going to transition in GC8, but it means we're not prepared enough or ready enough for the transition as we had hoped we would be at this point. And we're competing with other priorities. The money is needed everywhere, and we don't even have to the level that we thought we would have. And so now we have to look at how do we do more with less. And so we're looking into all of that, and also speaking to all the different donors to say, please bear with us. This is our reality. It's we're having a different financial environment, and so we need to be cognizant of that as these transition plans are put in place. We also don't want a situation where, for example, like what happened in Europe, where countries transitioned and then within the year, first year or two, there was a resurgence of the disease. And so we want to learn from some of these things that have happened and say, how do we do this in a systematic and responsible way so that we get the best out of the resources and out of the transition process? Yeah. Thank you, John. You can move to the next. The next slides were just me trying to summarize some of the processes and also just to advise, civil society colleagues on what they need to consider in transition. We don't necessarily need to go over all the beginning ones because I talked to it. We had developed a sustainability financing roadmap, which was from 2023 to 2030. We're trying to follow it as much as we can. We looked at ways in which we can integrate the program. I know most of the integration is happening in GC8, but for us in GC7, we're already trying to see how do we do pre-integration, or we do integration to see how it works for us and how to make sure that by the time we move into the GC8, it's seamless, or at least it's not having as many teething problems as it's having. So we're trying to work with what we have. We also, for us, I would say our biggest risk is that as we transition to government, because obviously the resources are less, we wouldn't want the quality of the program to be affected. So we really need to look at how are we going to be able to provide a minimum service package that still serves communities, particularly key and vulnerable populations. And then also to make sure that there's continued political and domestic financing and political will to this, right? As governments change, you don't know what people's priorities are. Obviously, right now, we have a human rights government, so we hope that things will continue, but we don't know how that plays out. And also, you can be a human rights government, but if you don't have resources to support it, it will just be theory. So yeah, and then just basically balancing transition and other pressing reforms. There's also issues around climate. Everywhere, everybody's having issues with climate. Also, countries are looking at their digital economy and resourcing that. And so we just constantly have to be at the table for whatever discussions are happening to remind people about why it's important to make sure that health is on the agenda, that HIV is on the agenda, that TB is on the agenda, just reminding governments that at the end of the day, it's people, and it's people who are at the epicenter of all these health, climate, any other issue. And so we need to meaningfully engage the communities most affected in any of the discussions. So my advice is you have to make sure that the transition roadmaps are transparent and they have clear timelines, they have clear responsibilities. You have to also strengthen community monitoring systems to track all that's going on, whether it's pre-transition, whether it's during transition, just to make sure that what is actually obtaining on the ground is what you had envisaged, so that then there can be conversations if it's not happening that way. And you have to build alliances with parliamentarians, with ministries to secure political commitment for health financing. Yeah, in terms of co-financing, I know some countries have struggled with that because it's almost like it's a little bit far removed. But co-financing is a really, really critical part of the whole global fund architecture, of the whole financing, because countries commit to contribute a certain amount to the response. And oftentimes, because there is no streamlined way in which you can check consistently that they are actually putting in what they said, it's sort of, it's under the radar. But I think what would be important, and maybe in us, there's some work that you can do there, is we need to almost develop almost like a tracker of sorts that we link to the reporting, where civil society can actually be checking what has actually been contributed to the co-financing by governments, so that then we are also able to hold governments accountable at each of the CCM meetings, at program review meetings, to say, but how far are you? We agreed we would do this. Will we still be able to do this by this time? Right? Because at the end of the day, it's still resources going to the people in response to the disease burden we purported that the country has. So it would be remiss of us not to support accountability and monitoring of that. Also, I think as part of the co-financing, it would be an opportunity for civil society to look into progressive taxation, innovative financing mechanisms. People talk about that all the time. But how do you translate that into reality on the ground? We need to look at that. We need to understand what it looks like practically. We need to appreciate what that means for civil society and how we can be involved in those discussions. And every single time we have a conversation, we need to reiterate that all the funding and every intervention that we do has to be equity focused. We have to ensure that we protect vulnerable populations. I'm almost done. I'm on my last slide, folks. Yeah, so basically, Botswana's sustainability transition co-financing journey is ongoing. We have some sustainability strategies in place. We have transition planning underway, and co-financing commitments are in play. And we just have to be better at monitoring how governments meet their commitments. Our challenges are fiscal constraints, risk of service gaps, particularly for vulnerable populations, and balancing competing national priorities. Our strengths are that we had a multi-sectoral stakeholder engagement, and civil society is there. Civil society are advocates. We just need to continue to support their capacity to do advocacy, and also ensuring that integration of health into broader development agenda is a staple at every setting. My final advice for civil society is that you have to be proactive in shaping sustainability frameworks, in monitoring transitions, and holding governments accountable for co-financing. And that's the end of my presentation. Thank you very much.
Wow. Thank you, Nana. That sounds like a lot of work.
It is a lot of work.
Yeah. Yeah, but I think communities, we are up to the task. I think we've been engaging and doing a good job. It's only that we need to jump into this transition process. But actually, you're right. You need consistency of community engagement in transition is required. If I look at what Botswana has done, what you presented, you have to be consistent over a long period of time. You don't walk in and walk out. You have to be there throughout the process. That's so that at least you can carry the process to the next level. I think that's really good lessons learned. Advocacy across the process you've done, and also the most important part is the assessment and looking at the risk for community interventions. So I think this is really beautiful. Thank you so much, Nana, for sharing this. So colleagues, I want us to quickly get into, so what Nana has given us is actually a very practical example. What is happening? This is real time now. They are actually in the process. They're doing that. They started from some time back. They are still within the transition process as a country, and Nana has been part of that process. So she's given us examples of what is happening in our region, that is Botswana. So I want us to look at now, if we look at that, all that process, that work that we've had from Nana and from Botswana. Can we hear from specific, some of our colleagues who have participated in GC8 processes and give us examples of what is happening in STC and with regard to the community engagement in that process? Are communities actually doing that? Are communities doing anything? Are there processes that are there with the guidance from the Global Fund that GC8, there's a heavy focus and on transition processes and co-financing and sustaining programs. With that kind of narrative going on right now, what are communities doing? Is there any action happening? So I would like to, we have a number of our colleagues who have joined us, who will be able to talk about it and share some of those experiences. With this regard, please allow me to welcome, I think we have Rachel, our colleague Rachel based in Ghana. She should be able to give us some of the examples that are based on her experience in Ghana and the other countries within West Africa with regard to transition. So welcome, Rachel.
Thank you, John. Hi, everyone. Good afternoon, good evening, depending on where you are joining from. Thank you for the opportunity to contribute to this session, sustainability, transition, and co-financing in GC8. I think a lot have been spoken around transitioning, but from our experience in Ghana, I believe that the starting point should be more of sustainability, because Ghana, we are not talking about transition yet. But then in terms of sustainability, we should not look at it. We should not look at the cost shifting from donors to government, but rather whether or not essential services remain available, accessible, acceptable, safe, confidential, and responsive to the people who need them most. And so if on paper, vulnerable communities cannot use them because of stigma, fear, distance, cost, discrimination, or lack of trust, then we have not really achieved sustainability. So I'll be speaking from the Ghana perspective, but I believe many of the issues are also relevant across Anglophone Africa. So in terms of GC8, what is really at risk from Ghana's perspective? And of course, when we talk about what is at risk, we all know that, community-led interventions or services are most at risk. So we are looking at community-led monitoring, adherence support, we are looking at TB community case finding, malaria community mobilization, all those things, psychosocial support, legal literacy, stigma, discrimination, key population program, especially because Ghana is also having a little legal issues around key population, around the anti-LGBTQ bill. And so that's also persistent GBV response and human rights and gender interventions. And so for Ghana, what we did was that the communities and civil society organizations were always a step ahead of the CCM. And so we had our consultation earlier than the CCM. And we decided to do this because we wanted to come up with our priorities and interventions to guide the CCM early, so that in the writing process, they know that this is what the communities have come up with. And so Ghana, for example, in their priorities, we came up with interventions like youth-focused HIV, TB, malaria prevention, human rights and legal literacy support, CLOs and CBO sustainability, integrated community-led services delivery, community data system, HIV self-testing, PrEP programming, all that, ITN monitoring and all that. And, these are not side events. They are actually interventions that help people actually reach and remain in care. But then the risk we usually face, even for GCA, GC6, is that when it comes to budgeting, these activities may be treated as soft or less urgent compared to medicines or test kits or diagnosis or ITN, if you know what I'm talking about. And so for Ghana, we are actively involved in the boot camp. We are actively involved in the writing processes. We are sitting through to make sure that all these key interventions and priorities raised by communities and CSOs are not just there, but they are also costed. Because without strong community systems, we may have communities and facilities, but people most at risk may not come forward for testing, treatment, or preventions, or even follow-ups. And so that is why we need to protect these community-led services. Maybe I'll stop there and hand over to the next speaker and come in when.
Thank you, Rachel. Can we also hear maybe from Emily Kayimba from Malawi? How have communities been able to engage? Have they been able to discuss, engage, or participate in transition, sustainability, and co-financing discussions within the country during the GC8 as we are doing the GCA grants? Yes, Emily, if you're online.
Okay, thank you so much. Thank you so much. I'm Emily Kayimba from Manaso, Malawi. For Malawi, we are actually submitting our GC8 proposal in October. That is window 3. So I think as the other colleagues have already said, I'm going to talk more about sustainability in the context of the GC8. As we are talking of sustainability, sustainability begins with understanding of where we are. And really, it was so interesting or touching to hear how Botswana has actually done as they are transitioning. So in Malawi, what we have actually done, we have used a tool called Community Response and System Strengthening Maturity Framework Assessment. This is a global fund tool, which is actually helping us to assess ourselves in terms of capacity, functionality, and the sustainability of community systems. And in this one, there were a number of dimensions, or it has a number of dimensions. That is governance, leadership, coordination, CRM, and so many. So what this tool actually does, it actually positions you to where you are in terms of all these dimensions. And really, it helped us to actually, it helped us to get the areas where we should actually strategically invest in GC8. So we identified the strengths, the weaknesses, the gaps in the community systems. And it also happened that we had government officials who came and presented their their priorities at the national level. And when I'm saying this, it was like a workshop where representatives from different constituencies came together. So we had the government, other development partners, and the CSOs. So it was really getting the priorities from the government, and now assessing ourselves in terms of community systems where we are identifying the gaps, and now saying these are the areas. Now we need to go down to the communities to get their input as well. As we are talking, we are in the process of going down to the communities, but using the higher priorities as those that we identified from the CRISS assessment, and even the priorities that were given by the government. And I can tell you that as this process, unlike before, we are seeing that it is actually strengthening the collaboration between the government and the civil society. And it is also helping us to even advocate for increased resources for our work as civil society in the areas that I have mentioned. As of now, because we did this systematically, we are even seeing the fruits of that so many organizations, stakeholders are actually coming in to help us in terms of resources and technical support. And we are so comfortable or that really, when we go to the writing, which is the starting end of this month, hello, which is actually starting at the end of this month, we'll be actually talking one thing with the government, unlike before. And we know, like now the GC7, we had a number of things that we included in the GC7, but when it came to reprioritization, some of the things were actually moved out. There is no, I think these are not impactful or these are not what, but it was because I think we started like working in parallel. So this time around with this tool that we have actually gone through, we are very sure that I think it will be an improved document, and especially now with the resources that are declining, will actually develop something that is actually sustainable. So it's something really that I wanted to share with you. I think as Malawi, this it should be an eighth country to use this tool, and I think they will be rolling to other countries. I know that others have actually done it in the Global Fund application already, but if you have not done it, maybe you may ask the Global Fund if you are also applying like the way we are doing, at least to go through this process. I'm telling you, it's a very powerful tool that can actually help in this time that we are actually thinking of sustainability and even integration and the transitioning. Thank you so much.
Thank you, Emily. Thank you so much for that experience. Now, colleagues, I think in the interest of time, we might need maybe to quickly shift gears. And all this we've discussed, IANASO working with the Global Fund, I think I had mentioned, developed a tool, a guide that can be able to help communities to engage and participate in transitional processes. So I will, with this regard, please allow me, before we get into the maybe open up for questions, please allow me to maybe ask the consultant who worked with the IANASO to maybe share on the tool very briefly, because we don't have time, maybe in the next 4 minutes, just highlights of the tool, where we are with the tool, and what needs to be done. And welcome, Margaret. Lisa,
thank you, John.
Okay, thank you.
Thank you, John. First of all, I want to thank IANASO and the Global Fund
you
for
may
the
want
opportunity.
to put the presentation on presentation mode.
Okay. First of all, before I start, I want to thank Yanaso and the Global Fund for the opportunity to participate in this discussion on STC and on the development of the tool, which is the Community's Guide for STC and Transition. This tool has been approved by Global Fund and is ready for use by the communities. We'll move quickly. I'll jump some of the slides that have been talked to or addressed by my previous presenters, but maybe what I can state, I'll just go to the main things that I must say. One of the things is the purpose for this tool. The tool was developed to guide communities or help communities understand sustainability, transition, and co-financing, and participate meaningfully in Global Fund processes, protect community-led services, and strengthen accountability before, during, and after funding transitions. Please note that this is a tool to help communities in this process of STC, that is sustainability, transition, and co-financing. What are the processes that communities are encouraged to undertake or to do? One of them is to understand the tool. They must be able to understand what are the key definitions, what are the key terminologies that are used by Global Fund. Then they must also understand the eligibility list and the key services at risk. Secondly, they must be able to engage and participate meaningfully in country discussions or country dialogues, and also prepare community priorities when it comes to sustainability, transitioning, and co-financing. And be actively involved in Global Fund cycles that includes the funding request development, the grant making, the grant implementation. Thirdly, they must be able to influence decisions at national and county levels. Then budgeting, domestic financing decisions, and any other policy decisions that touch on sustainability and transitions. Fourthly, they must be able to monitor government commitments, service continuity, community financing, and accountability, and also be able to sustain this. How do you monitor for sustainability after transitions? Then moving on to the next slide. What makes the tool different? First, the tool tells communities not only what STC means, but it helps communities to actually do what is supposed to be done under sustainability, transition, and co-financing. And it provides questions that communities should ask, that we should ask during this transition period, during these discussions. And one of the questions that communities will ask or are encouraged to ask, well, what services will continue when funding changes, and who pays for these services from then henceforth? Those are some of the critical questions that communities should be able to ask. The other thing that the tool provides is the risks that come along when it comes to transition. It provides quite a number of risks that communities should be able to ensure that these risks are mitigated. The decision points where these are the points where critical decisions are being made regarding the key services that should transition and anything pertaining to sustainability and co-financing. Then the other thing that the tool provides is the advocacy actions. And then also it also provides accountability tools and practical checklists. Maybe I can mention some of the things that the tool also does. What are the requirements when it comes to countries? And then from there, we can look at what are the requirements for communities or why this matters for communities. One of the requirements is for countries is to ensure that there's increased domestic financing. Financing from country-owned resources should increase towards HIV, TB, and malaria. That is one of the things that should be done. Then enable social contracting. Then strengthen community systems and accountability. Remember that it is not only about financing, you also have to make sure that the systems within the country are ready for these transitions and also manage risks to service continuity. Move on. How do we apply the tool across GC8? One of the areas that communities can apply the tool during this cycle is community dialogues, funding request development, and implementation. The tool provides the areas where you can actually, like for example, during community dialogue, what should you do? One of the things is to identify services, transition, and financing risks, and ensure that these risks are mitigated. Then also advocate for CLM, CSS, and social contracting and any other domestic financing to be increased. Then under funding requests is include domestic resource mobilization, human rights and key population services. Ensure these are included in the funding request. Then for implementation is to ensure that you watch or be able to confirm or to monitor what the country is doing in respect of transition readiness and financing commitments, and also be able to monitor the budget allocations. Remember, budget expenditure or budgets are not always released on time in most governments. So what happens during that time? The services will be delayed or there will be service disruptions. So those are some of the things that communities should be able to monitor during implementation and after transitioning. So what are the key takeaways across the 3 stages? That communities should be able to develop at least 10 priority interventions that should be budgeted and protected. Those interventions should be budgeted and protected, and there should be we should be able to track these government commitments, budget releases, and service continuity using the existing accountability mechanisms. Quickly, we can move to the next slide. What are the key questions communities should ask during funding? Questions relating to funding and risks. What funding changes are expected and when are they expected? What services or which services may be affected and who relies on them? Then the other question has sustainability, transition, and co-financing priorities, services and transition safeguards being retained. So these are the tool gives you some of the questions, some of the risks that should be able to monitor as communities. And then we should build that also based on evidence that we have collected from the ground. We move on. What are the strategic actions in GC8? First is to understand the GC8 priorities. With that, the community should be able to understand the modular framework, including what are the safeguards that have been allowed within the modular framework and prioritize. Some are prioritized, cost them, engage CCMs and country dialogues to ensure that these priorities are actually end up in the funding request and in the grant, and then position for implementation. What are some of the sustainability, transition, and co-financing activities communities can push for in GC8? One of them is ensure that you participate. Communities, we should be able to participate in the national sustainability and transition plans. And that should be a priority, should be included in GC8. And then conduct transition readiness and risk assessments. That should also be prioritized in GC8. Then strengthen community systems. Then strengthening or expanding CLM monitoring, advocating for more resources to be included in the GC8 and ensure that budgets are available, among others. Because there's quite a list of activities where communities can actually engage and push for in GC8. This is also, there's a detailed annex within the tool that communities can use that can guide communities even on which module, which intervention they can plug in some of these things that we've listed here. Maybe we move on. quickly. You can see time is not on our end. The tool also supports community advocacy. It helps communities to move from where we need more funding, us saying that we need more funding, to saying that we have evidence to support what we are saying under STC. And some of the sources of evidence include the CLM data we have, the budget tracking, the service monitoring, transition readiness, among others. Finally, we will also the tool also looks at what success looks like, then the expected results and the key messages. Maybe I can just look at the key questions or questions that really need to come out during these discussions. What STC risks are most significant in our countries? Which community services need to be protected under GC8? What domestic opportunities exist? And what actions should communities take before GC8 milestones? The next GC8 milestone. Those are very key discussions or discussion questions that will guide communities to ensure their priorities are actually included in the GC8. And with that, I think I've come to the end of my presentation. And the key message is that communities are not only beneficiaries of sustainability, transition, and co-financing, but they are essential partners in shaping sustainable, equitable, and resilient health systems. Thank you so much. I'm sorry I didn't have enough time to discuss the entire tool, but it's available in the ENASO or on the ENASO website. Back to you, John. Thank you so much.
Thank you, Margaret. Thank you so much for that. And colleagues, as we've had, this is some of the work that ENASO has done. And of course, this was based on discussions and engagement with communities, and especially getting experience from people who have done this before. So this tool, the main objective, as Margaret has mentioned, is to help us as communities to engage in STC processes and step by step. And it also was very specific for GC8, where we find activities for GC8. Some of you asked during the presentation that I think this even started with Philip Nyakwana, where do we get financing for STC? So as the tool guides us in the modular framework as we design our programs, that there are actually activities that are within the modular framework that involve maybe financing for transition planning and all that. So we can be able to push our writing teams to be able to include those activities that can be funded through the Global Fund GC8 process to support community engagement in STC. So they are there. This tool gives us direction to where to get those interventions. And as Margaret has mentioned, this tool is, I think it should be online now within the ENASO website. So it's free for you to download. And if you have any questions, please, you can also reach out to an ENASO in terms of the application and all that. So thank you so much, Margaret. Thank you so much for that. I'd like now to quickly look at I think we're coming to an end of this discussion. Sorry we took so much time in the presentations. We didn't have enough time for questions and answers, but we'll pick all the questions, put them together, provide answers. And we normally have, after every webinar, we normally have a newsletter that Lisa has mentioned. We will package those questions and ensure at least they appear in our newsletters for you to be able to read and get questions. Thank you. I'd like to now hand it over back to my colleague Lisa, who can give us the takeaways and maybe closing for this session. Thank you. Over to you, Lisa. Yes, Lisa, you there?
Yes, thank you so much, John. Apologies, my internet was buffering a bit. I hope I'm audible.
Yes, you are.
So I just really want to thank all of our speakers, but maybe John, a quick one before I transition to giving us the overview of the entire conversation and maybe a few next steps on how communities can keep engaging with this conversation. we did have one speaker who was to talk about how we can utilize CLM data to inform sustainability and transition plans of countries, Mr. Onesmus Mlewa. Maybe we can just bring him on board to speak in the next short 2-3 minutes. Then I can give us our closeout. Mr. Onesmus, I hope you're available.
Thank you. Sorry, I was looking for him on the list. I didn't find him. So, Onesimus, please come on board. Colleagues, Onesimus is going to give us what has happened in Kenya with regard to how do we sustain, especially the CLM as a community strategy and intervention. Welcome, Onesimus.
Thank you, John. Thank you, John. The conversation have been quite exciting, and I totally understand. I'll take a very short period so that I know this webinar has taken quite long. So I think CLM is one of the core priority areas that Kenya communities is actually really prioritizing for GC8. And this is not just a coincidence, but is very, very intentional to ensure that communities are actually taking charge of their health outcomes by informing what decisions that needs to be made based on data that they have collected themselves, analyze that data, and using that data to shape the conversations on sustainability, what needs to be prioritized in the country. And we are seeing this extremely strong in GC8, where communities from the pre-GC8 dialogues had already started positioning themselves on using CLM data to ensure that they will inform the writing of the GC8 and what needs to be prioritized. So what are the key things that I really want to bring to this conversation? CLM has taken quite a strong root in Kenya, and the conversation is actually going towards institutionalizing CLM within existing government systems. What does this mean then? What this means, there shall be demand creation for CLM data, hence ensuring continued and sustainable engagement of communities to generate data so that they can continuously inform decisions that are actually being made both at the health facility level, the county level, and the national government level. So this is a strategic approach where when demand is sufficiently created, then you will see that when it comes into sustaining CLM interventions, it becomes a little bit easier because both the national government, the county government, and the health facility shall have seen the relevance of communities to generate this information or this data so that it can be used for programming. And what is actually happening currently in GC8 in Kenya, because of this kind of a push, we are seeing a very proactive community engagement in GC8, and some of the issues that are actually being put on the table right now around strengthening CLM is actually to retain specific community-led delivery service centers where CLM can actually be annexed, or it can be the nexus of CLM to engage at the different health facility points. And this also will mean the retention of community-led human rights sensitive programs because CLM is actually able to identify those peak issues of around addressing stigma and discrimination, gender-based violence, criminalization and incarceration, which are hardly actually picked up by national health monitoring systems. So these are some of the core interventions that are actually being targeted for GC8 right now, and CLM and community are actually taking leadership on this. So just to say that communities, the call for communities right now when it comes into sustaining their interventions is that community programming should actually not be hastily transitioned, and this conversation has really been spoken very widely in this webinar today due to the structural barriers that exist. We really cannot move towards transitioning or fully integrating all interventions considering that there are still structural, political, and social barriers that were the very essence of ensuring that community interventions were planned and implemented in the way they are being implemented today. So unless those have come to a level where they have been significantly addressed, then we can actually now start talking of transitioning fully and integrating KP interventions in a fully integrated manner. Thank you very much, John and Lisa, for allowing me to speak on these few scenario cases for Kenya. And this has been a good webinar, very enlightening, and let's keep it up, guys. Thank you very much.
Many thanks, Onesmus, for that. And I think this is very practical. CLM is one of the both a tool that can be able to help us engage and participate in transition, sustainability, and co-financing, as well is a community strategic approach that needs to be sustained beyond the funding cycle. So that is a message well received, and we are glad Kenya is at least taking that direction. So I'd like to allow, maybe bring on board Lisa now to just sum it up as we close. Thank you. Over to you, Lisa.
Right. Thank you so much, John, for the amazing facilitation. This conversation is not only timely, but it's extremely interesting. It's extremely relevant, especially as grant writing is still continuing for Window 2 and Window 3 countries. We all know that Window 1 already submitted on 8th of June. So we can never tire from the sustainability transition and financing conversation. And every single time I engage with communities in Anglophone Africa, the message remains constant that communities are the ultimate sustainability plan. And even as we think about that, let us just quickly reflect on some of the key highlights from this conversation. But as John said, we're going to be sharing a newsletter that will give a brief of this entire conversation, but also this recording, that if you want to reference it, you can always go back and watch it, but also sharing the link to the STC tool that Madam Margaret just presented to us. So in summary, what this conversation has really highlighted is, one, that transition is a progressive process. However, even though it's progressive and phased, we need to ensure that we as communities, we are at the front line to ensure that national processes, national policies, national responses are aligned towards ensuring that key programs, key gains are sustained, whether we have donor funding or we do not have donor funding. Also, Anthony taught us about the power of matching funds and country-owned transition planning. For Window 2, Window 3 countries, and the others that are coming up next year, 5, 6 windows, let us be intentional even as we're writing our funding request to ensure that we are talking about transition and sustainability as we list down our priorities, as we cost our activities. Also, we had an amazing case study from Botswana, which all of us have learned a thing or two, especially around meaningful community engagement. But then also our community panel giving specific examples from Malawi, Ghana, and Kenya have taught us a couple of things, like what does community in practice really mean? How do we think about CRSS? How do we think about strategic partnerships with our governments and community organizations and community networks, KP networks, AYP networks, women-led networks? How do we bring them on board as part of our transition plans? What does meaningful community engagement really, really mean in practice, not in mention? But also, how does community data translate to informing the future of our countries, the future of the progress that we make when it comes to addressing issues on HIV, TB, malaria, and RSSH. So I don't want to take so much time to, talk about everything that has been said. It's called mansplaining. But in summary, what I want to say is, even as we engage with STC tool on the ENSO website. We have also partnered with Global Advocacy Data Hub to collect STC experiences across the world, but also how are communities prioritizing sustainability and transition within the ongoing GC8 funding request processes. So allow me to just quickly share a slide. I hope you can see. So with our partners, we have launched a survey or a study known as the Msingi study, and basically this study is to help communities document what integration looks like in their communities, what transition and sustainability conversations are like within the ongoing funding request process, but also share your GCA writing experiences. So feel free to scan. Let me just put this on slideshow so that it's like really big. Feel free to scan the QR code on your screen. We do have an amazing array of partners, but also all the learning hubs across the different regions. We do welcome you to participate in this survey. If you had a question that you felt was not fully addressed in this learning session, we welcome you to redirect it to this amazing survey, and we promise that it's going to be addressed. But also feel free to engage us within the Anglophone Africa Learning Hub, but as well as our ENSO website. And that's it from me, John. So I just want to hand it back to you, but thank all our amazing speakers, our partners, the Global Fund, and you, John, for the amazing moderation. Thank you so much.
Many thanks, Lisa, for that. And please, colleagues, feel free to scan and let's answer the questions, so at least we can provide answers. I would like to thank everybody who participated in this, especially our speakers who have given us information right from the Global Fund with Anton Kinghorn. We've also heard from Philip Nyakwana, Rachel, Onesimus Mlewa, Emily from Malawi. Thank you so much, and Nana, for sharing the example that you have gone through. Thank you so much, colleagues. Also, this has been a very long webinar. I know, more than 2 hours. So with this regard, I'd like to say thank you so much for your participation, and look out for our newsletter that is coming, and that will provide most of the explanation and answers that for the questions that we did not be able to answer. With that regard, I'd like to thank the entire ENSO team that is here, Levina, Kennedy, the executive director, and the rest of the colleagues at the ENSO Secretariat. And thank you so much. Enjoy your evening. And please look forward to a newsletter that will contain a summary of this and some of the questions that we are not able to answer. Thank you, colleagues, and enjoy your lovely evening. Thank you.
Thanks.
Thanks and bye.